As a woman, and as someone who cares deeply about the future of health research, I'm honored to be here at Sunnybrook Estates for the future of women's brain health. Leading voices in science, medicine, advocacy, and lived experience explore an issue that affects millions of women, families, and caregivers. As research continues to uncover important differences in how brain health conditions impact women, conversations like this are helping to drive awareness, inspire action, and move us closer to better prevention, treatment, and care.
When it comes to women's brain health, we're all concerned. As women, as mothers, as allies, as friends. And we live in an era where brain research is booming, but is women's brain research the focus? And when we talk about the brain, we know that it's related to, the gut and the heart and all the systems in our bodies. So we have to work at the root of our problems, and brain health is beyond important.
It would be that we need to meet women in the moment that they're at now. We have to actually help them from a clinical perspective and then integrate that clinical care into research so that we can understand their brains going forward in a longitudinal way. There's work to be done now, and the work that we do now will help us with the discoveries that we need to make down the road in order to make an impact in the trajectory of a woman's life.
I think I would love to challenge the idea that when women go through menopause, it's the end of the road for them. We've been conditioned to think that menopause equals aging, frailty, and the start of decline. And it's the opposite. This is a time for us to thrive and almost reinvent ourselves if we want to.
So my goal as a family doctor and as a menopause provider is to ensure that people feel heard. And so if you are feeling off from your regular routine, you don't feel like yourself, if you're having symptoms that are affecting your daily functioning, so that would be hot flashes, brain fog, fatigue, any of those things, warrant investigation and getting support. You deserve care. And we don't need to dismiss that anymore.
Aging is a privilege, but you can't fake radiance when you're depleted. And to not be depleted, and millions of women are, we got to understand how we function, how our bodies function, and we got to have the data and the research to allow us to better understand who we are.
The answer is always going to be exercise. It's one of the best research interventions that we have, and everyone will benefit. Every single person who starts to exercise will reap the benefits, and honestly, I can't say enough about it.
One common misconception about brain health that I'd like to change is that there's a lot you can do for prevention. So 45% of brain illnesses in terms of dementia risk can be reduced with lifestyle changes.
I think the reason it's receiving a lot of attention is that it's a really understudied and underfunded area. And I think only now are we beginning to really see the need for the research. These things affect half the population, and we need to be talking about them. If we're not talking about them, then the research isn't getting done and the questions aren't getting answered.